Ow, my arm nerve. Why would you pinch nerves?
Today,
And he's laughing at me for it.
Today, tune in to the 50 Shades of Pain show where we're talking about pinched nerves. Nerd. Welcome to the 50 Shades of Pain show, where we empower our community by demystifying pain, both physical and emotional, to give you the tools that you need for optimal health. Hi, I'm Dr. Danish, Medical Director of Wellward, and I'm here with Dr. Escaloni, physical therapist and movement extraordinaire. We were thinking, pinched nerds. That should have been what we did.
That was definitely appropriate for what you guys just witnessed.
That's right. So we're talking about pinched nerves, and no, there is not one arm nerve that goes down. So pinching James did not hurt his nerves in any way for those of you concerned about.
It didn't feel like it.
So what is a pinched nerve to begin with? Well, what can happen within the body is that nerves are like wires that go all throughout our body. If you ever look at an image of the nervous system, it's an impressive array of wires throughout the body. Well, these wires, every time you move your body, have to move correspondingly with it. Like if I'm flexing my arm, that nerve is going to have some slack to it, and if I'm extending it back out, it's going to have to take up all that slack. So across these different junctions of the body, a nerve can get trapped in some scar tissue and become a quote-unquote pinched nerve. Typically, when people talk about pinched nerves, they're thinking about their spine, but because you've got nerves all over the body and movement and tunnels and things, you have a variety of places where a nerve can actually have some entrapment or be compressed, and thereby what we colloquially refer to as a pinched nerve. Now, when doctors are talking about pinched nerves, oftentimes they're talking about the spine, but the truth is, when I was in medical school, they talked about pinched nerves as if that is the main reason people hurt when it comes to the back.
Same thing with surgeries, right?
Exactly, and I found that to be actually quite uncommon, and I can say this with confidence because when we do pain mapping, we're actually tracing the root cause of an injury causing pain, and we'll actually inject around the nerve to see how entrapped it is, or take a look under ultrasound to look at the diameter of that nerve. In areas where there is an entrapment, the nerve is actually going to swell up and look different, but it's very uncommon to find pinched nerves in the spine as the main problem. It's usually the downstream effect of many other problems taking place.
So if somebody has a pinched nerve and it's a real pinched nerve, what type of symptoms do they have then?
Well, they can have weakness and pain in a particular wiring system of the body. Like for instance, if you've got a pinched nerve at a nerve root, every nerve associated with that root is going to be affected, and you're going to see weakness, you're going to see motor coordination issues, qualities of pain like pins and needles, sharp jolts of pain. It can even be a dull achy pain. But I find that to be an uncommon cause. Oftentimes the ligaments associated with that nerve root are more often the problem causing that kind of a pain. I've injected enough ligaments to know that I can put numbing medicine on a ligament and all of a sudden that pain goes away, telling me that it's not necessarily the pinching of that nerve, but rather the damage associated with that nerve.
So if you've got somebody who has pain that's maybe in their neck and their shoulder, it goes down their arm, and if like, ow, every time I move my neck it hurts down through here, it's not necessarily a nerve.
It could be, but it's not necessarily that nerve. There's a variety of different things that could be causing that. But what often happens is because physicians are so concerned about nerve damage, which is a reasonable concern, they're very aggressive about treating the nerve without looking at other potential causes. Because even though the nerve looks like it has some compression around it on an MRI or some kind of imaging, that can be from a ligament being lax elsewhere. So just opening that space up isn't necessarily going to fix the problem. Sometimes what I tell patients is if you ever had your hand caught in a door, you'll note that it's not just the thumb that got crushed that hurts, the whole hand will start to pulse, and it's because the signal from your thumb, it's such a loud alarm bell, your brain really can't tell where it's coming from, so the whole hand pulses because of that. And the same thing can happen. Yes, indeed, a nerve that goes to the hand could be entrapped somewhere causing a pinched nerve, but it could also be that there's a loud signal within the path of that nerve that's confusing the nervous system as to where that problem is coming from.
So I think that the audience should definitely understand more about how this laxity of joints could affect nerves by looking back at some of our previous episodes when we talk about arthritis, for example.
Yeah.
So we talked a lot about that, about how these joints can move extra to cause potential laxity, too much movement, so a nerve could potentially be injured.
Yep.
But unfortunately, because as common as that is, it seems that those extra lax ligaments can also be the pain that you're feeling.
Yeah, that's right. So it's a process of figuring out whether the area of that nerve that seems to be affected is really signaling pain because of the nerve or because of some tissue within that nerve. And that's that complex process of pain mapping, where we're using the nervous system and the ligament system, the muscles, all of these different systems to figure out if it's not A, then it's B, then it's C, D, etc. Typically, I'll say that there are two things to look for when we're really concerned about pinched nerves. One is if there's been an acute injury recently, meaning like somebody has had a fall or a car accident, and there's all of a sudden a distribution of pain that follows the path of that nerve, that can signal an actual pinched nerve, because in that sudden shift, if there was pre-existing instability, then tissues can shift and now put that nerve in a compromised position, which is a more consistent pinched nerve. Or a chronic issue, something that's taken place long over time, can cause actually circulatory issues that cause a diminished circulation around that nerve and cause pain. But it's not necessarily a pinched nerve as much as it is a reduction in circulation.
So it sounds like pinched nerves can happen if there's either one, an actual compression on it, something squishing it.
Something rapidly change.
Okay. Two, that something is squishing some blood near it, so it's starved for blood, so it's angry and stenotic.
Exactly.
Ischemic, I should say.
Ischemic, yeah.
Yeah. Or there's maybe swelling around it, so that's literally squishing it from the swelling.
Right.
Those are the big ones, right?
Exactly. So yes, three things that can cause pinched nerve symptoms. Okay. But it's important to figure out which of those it is, because the treatment's going to be very different, and surgery is not going to fix every single one of those issues.
I'm very glad you just said that. So if somebody is coming in, and let's go back to the neck, they're like, ow, I look up, I've got electrical shocks down my hand. We test their muscles, and the muscles in a certain distribution are kind of weak, and they're very numb in that same distribution. It sounds like it's a nerve. What do we do for that person?
So first thing is we want to calm it down, because yes, indeed, if there is swelling there, just simply calming the swelling down can reduce the compression, but our job isn't done yet. We have to understand why that happened in the first place, and that's using our tools to figure out where the laxity lies and where the instability lies. While one option would be to just make the hole bigger where that nerve is traveling through, a more solid long-term option would be to actually create greater stability in that section so that that nerve doesn't continue to get pinched.
I think that's going to be a nice way that we can get the pain calmed down, and it sounds like through that pain mapping process we'll be able to figure out why it happened and what they can do to not let it come back.
Exactly. Through the pain mapping we can figure out which of those three different potential causes of pinched nerves there is, and then secondarily what's the most sustainable long-term solution, as opposed to what's just going to help right now but potentially introduce you to more scars. Meaning if you operate on it and you open up that space, yes, it can relieve the pressure off that nerve, but it's also ignoring the instability that caused that to begin with. So a better long-term solution would be to use strategies that help stabilize that segment, whether it's through exercise, whether it's through different types of injections that help stabilize ligaments and structures around those nerves, or whether it's just simply reducing the irritation and inflammation around that nerve to buy us enough time to get greater stability and strength there.
I like that you said that surgery is not essential for that person.
I would say it's essential in certain situations, but those situations are rare. Like those situations where there's a radical change of trauma, fall, acute injury, those may be in situations in which surgery is unavoidable, because the time it would take for things to stabilize is too long and you could end up having some nerve damage. But if you're dealing with something that's been a chronic progression over time, it's worth taking the time to pain map it, figure out where the origin of the problem is, and decide if this is something that only surgery can fix, or if some of these other more conservative advanced treatments are going to benefit.
That sounds like a good plan, and it's a little bit of semblance of hope for these people who are
Absolutely.
worried about just, I have to have surgery, I have to have fusion because my neck's been hurting for 10 years.
Absolutely. No, there's definitely solutions outside of just surgery alone.
Sounds like a plan.
Well, if you found this to be helpful, give us feedback, give us comments if there are any questions that remain. We always read our comments and respond to them. And look us up on our webpage, wellwordmed.com, or our other channels of access, whether it's Facebook, Instagram, YouTube, or our podcast on iHeartMedia, Spotify, and Apple iTunes. All of those sources, we really value your feedback and giving you the knowledge that you need to take power, control over your own health.
So, until next time, I'm Dr. Escaloni.
And I'm Dr. Donish. We'll see you next time.